You've had your hearing tested, you've seen the ear, nose, and throat physician, and now it's time to have a hearing aid evaluation. Let's talk about how we can prepare for this appointment. When it's time to come in to see the audiologist for your hearing aid evaluation, there's a few things that usually make people much more successful in this process. Typically, bringing somebody with you, a loved one who lives with you, usually a spouse or an adult child, somebody that helps make big decisions for a pretty big life-changing event. This isn't so that your spouse or loved one can pick on you about your hearing, but it is more so that we can get as much information as possible. Research shows that the more we know about you and the more situations we can help, the more successful people will be when they do get their hearing devices. If there are any questions that you have about what kind of goals or what types of things you want to make sure are talked about, writing them down would be really helpful too, so you and your spouse or loved one make sure that all of those topics are covered at the evaluation appointment. The audiologist will go over your hearing exam. They'll ask you questions about what it is that you do on a daily basis to figure out what type of device would be best based on your hearing exam and based on your needs and symptoms. There are different levels of technology and different devices out there, so it is about an hour-long appointment to discuss all of these things, so just prepare time-wise for that. When I have patients come in for their hearing aid evaluations, typically I'll have them fill out a survey given to them by our office that talks about possible difficulties, and we'll ask them to bring a loved one with them so that everybody's on the same page. We'll go over your hearing exam together after we find out what difficulties you may or other people may notice, if any. And if we find a solution is necessary, then we'll talk more about hearing devices in detail. That does a lot of times involve you getting to listen to what corrected hearing sounds like through a pair of hearing devices programmed for you. We'll go and do testing in the booth with your hearing device to do another hearing exam to see how close our hearing threshold and our speech clarity is to as normal as possible. At that point, we talk about what possibilities are there for you, features of devices that you want, are interested in, and then we'll pick out what devices are best for you. And I will give you my one best recommendation based on your hearing exam and those symptoms that you have of the hearing loss or difficulties that you find in your environment. When we do a demo on the hearing devices, when you get to listen to them, your hearing exam will be embedded in the memory of the hearing device, so it is programmed specifically for you. At that point, we'll be able to listen to your loved one to see, well, since their voice is familiar, that's another reason why we have you bring them. How do they sound? What are the differences like? Hearing devices should be comfortable and clear, and those are the things that we make sure that we like the way they feel and we like the way they look, so that typically in about a week or two, when you've gotten used to them, they've become a part of you. At that time, when you talk about hearing devices, it'll be a good time for us to discuss your insurance benefits options if there are any. The audiologist will go over that with you at the time of the evaluation.